have invited a cardiologist here, and we can't leave heart health out of our discussion today. Let's talk about heart health. How do we keep our heart healthy? So if it's not the fat that's causing heart disease, what is it?
Well, again, it's not one thing, right? But so you could say eating fat is related in the sense if you're overeating fats and carbs and calories, then okay, that's implicated in increasing weight, increasing insulin resistance, and decreasing metabolic health, and increasing cardiovascular risk. That is all clearly related. But you can certainly get there eating very little fat and tons of carbs and overeating carbs and sugar, and you can get to the same place, right? So it's clearly not just the fat if you can get to the same place doing it that way. So I think one of the biggest changes that I'm starting to see is people being more aware that metabolic health is cardiovascular health, that they're one and the same, right? Cardiovascular health for decades has been LDL and dietary fat. And like, that's cardiovascular health. No, not at all. Not at all. It's really metabolic health is probably first and foremost. And lipids, especially LDL, are going to be secondary, if not tertiary. Not that they have no role. They certainly have a role. But, you know, there's this great study, a retrospective analysis of the Women's Health Initiative. And it was, I forget, like a 20-something year follow-up. And they looked at what were the conditions present at baseline that predicted the development of cardiovascular disease the most. And LDL was on there with a hazard ratio of like 1.4. So not 0, you know, not 1.0, but 1.4. ApoB was a little better at 1.9. And ApoB is just a better lipid marker than LDL. But this measure of insulin resistance was at like 6. And type 2 diabetes was at 10. So, I mean, like, if that doesn't help put things into perspective, I don't know what does. That metabolic health is cardiovascular health. And that's what we really need to focus on. And then, but also factor in lipids as they play into it. And lipids meaning HDL, triglycerides, VLDLs, small dense LDLs, and LDLs, right? All those things are under the umbrella of lipids, and they all matter. So and of course, blood pressure matters, right? Inflammation matters. Like, all these things are part of cardiovascular health. So when you say, how do we improve cardiovascular health? Well, you find a way to fix all that. You find a way to normalize all that. For some people, a low carb diet along with exercise is going to be a fantastic way to improve every single one of those markers.
So how did we come to blame LDL? I mean, even there are obviously the lower density sort of LDL particles, and then there's so let's go into the details and how we came about, you know, blaming, oh, HDL is the good one, which we don't doubt, but people are now starting to doubt whether LDL.
Actually, people are doubting whether HDL is the good one too. So again, it all comes down to observational data, observational science. That if you go back to the Framingham study, you look at total cholesterol, or then other studies, you look at LDL cholesterol, and it correlates. Those who had higher total cholesterol or higher LDL cholesterol had a higher risk of developing cardiovascular disease. Those who had lower HDL have a higher risk of developing cardiovascular disease. Again, is it a dramatic blow your socks off kind of increased risk? No, it's a small signal, but the signal's there. But then again, you have to say, who is the population we're looking at? And it's a general population eating a high carb, high fat, high calorie kind of diet. They most likely all have some version of metabolic dysfunction. You know, what wasn't measured in the majority of the trials, so we don't know. But when you correlate for HDL and triglycerides, which are good surrogates for whether or not you have metabolic dysfunction or not, now all of a sudden LDL becomes much less important. And again, not that it's not important, but it becomes much less important. So an elevated LDL with somebody with type 2 diabetes or somebody with high triglycerides and low HDL is more of a concern for me than an elevated LDL with someone with normal insulin sensitivity, low triglycerides, and normal to higher HDL. Again, put it in perspective. There are other things that would make me concerned about that elevated LDL, even in that metabolically healthy patient. But boy, it's a lot less of a concern than it is in that metabolically unhealthy patient. And so that's the differentiation I think we have to start to make and evaluate people more holistically. That's kind of a dangerous term sometimes, but from a broader perspective. And then, what's their calcium score? What's their family history? What's their blood pressure? Do they have a history of smoking? All of these things come into play to say how important do we think your risk factors are. But that's a complicated discussion, right? Would that take me 2-3 minutes to describe, as opposed to being in a doctor's office and saying your LDL is high, we need to bring it down to improve your heart health. That took 3 seconds, right? So much easier to say, to understand, to do, but I don't know that that's doing our patients a whole lot of good.
And also because there's a drug to lower LDL.
Yeah.
So it's easier to recommend that and give the drug, prescription for the drug. Okay, so how dangerous are the triglycerides?
Well, triglycerides are dangerous, I guess you can say, from a couple different reasons. One, they appear to be independently correlated with increased risk of cardiovascular disease. So what that means is, above and beyond anything else going on, if your triglycerides are high, there's a higher risk of heart disease. But the second reason they're dangerous is because they are associated with metabolic dysfunction, with insulin resistance, with prediabetes and type 2 diabetes, and with increased VLDLs and hyperinsulinemia, right? High triglycerides are associated with all those other features. So they're a marker of poor metabolic health, which is also why they're dangerous. So, the normal, quote unquote, normal triglyceride is set at 150 milligrams per deciliter. And sorry, I can't do the math off my head to do the.
I'll convert it. That's okay.
Yeah, but from my practice, people I see in my practice, I'd like to see them below 100 or even lower. I want to look at the triglyceride to HDL ratio to get that around 1.5 or less. So it depends how aggressive you want to be, but it's clear that addressing triglycerides and helping lower it with lifestyle, not necessarily with drugs, but with lifestyle, is going to be one of the most important things you can do to help people.